Hello, Happy New Year. I'm back again. I have a video to share with you from a very beautiful lady that I love the look of her skin. Her name is Tamara Timeless Beauty, and this topic is based on her 16 years of Botox journey for preventing wrinkles and strategies for 40s, 50s, and 60s, right? So her video is before me here. I'm going to be sharing the video with you. And as you all know, I'm going to be interjecting with my own opinions. As we plod along, we both have something to learn. I hope you enjoy it. Okay.
Hello. One of the most common questions and comments that I receive here on YouTube is, what have I done to my face? And the short answer is Botox in my 11s and my marionette lines every 6 months, last filler 2017. So I thought it would be fun to do a little bit of a deeper dive into my Botox treatment history and share with you my 16 years receiving Botox. So I have a lot of experience to share with you. If that sounds interesting to you, I would love it if you would throw this video a thumbs up. That really, really does help support my channel, and I really appreciate it. So without further ado, let's jump right into it. I am going to put my glasses on because I have a lot of notes and I don't want to forget anything. First, I want to say I am not here to tell anyone to do Botox. I am not here to encourage anyone to do Botox. It is a very, very personal decision. I have friends that love Botox. I have friends that wouldn't touch a needle with a 10-foot pole. It's all good. We all have to make decisions that we feel comfortable with. Having said that, even if you're not interested in having these types of treatments, sometimes it's just really interesting to learn more about it. So I am going to start with some general information about Botox, and then I will jump into my treatment history and how the Botox treatment that I was receiving at age 40 changed in my 50s, and again has changed now that I am in my 60s. Okay, so general information about Botox. I've known that Botox has medical uses, and I've known that for quite a while. I know Botox is used to treat spasticity in children and adults with cerebral palsy. It is used to treat migraines. It is used to treat TMJ. What I didn't realize until I started researching for this video, it has been in use medically since the 1970s. That's a long treatment history, right? Botox was not approved for cosmetic purposes until 2001, and in the last 20 years since Botox was approved for cosmetic use, it has remained the #1 most popular cosmetic treatment. And currently, I think we're at around 7 million Americans do a Botox treatment every year. That's amazing. That sort of blew my mind. How does Botox work? I think there's a lot of misunderstanding about Botox. It doesn't paralyze your face, it doesn't freeze your face. Botox is a neuromodulator, and there are other neuromodulators. There's one called Dysport or Dysport, and there's one called Xeomin. I personally only have had experience with Botox, so I am going to be saying Botox throughout this video, but much of this information will apply to those other neuromodulators as well. All right, so very, very basic Botox.
All right. I just put my microphone on. I have something to say here. Basically, skins react to external stimuli differently. I know it's been said to test for allergies before you proceed, but we can't rule out medical mistakes. Perhaps the needle for the Botox, even by the highly experienced expert, hits the wrong nerves in the muscle area that could lead to paralysis. Anything can happen. I'm not a medical doctor, but I'm just saying, for example, say you are going for any procedure in a hospital, they would let you know that anything can happen. Even the operation may have been successful many times, doesn't mean that that particular operation you're going to undertake that time would be 100% successful. There is always room for errors medically when you're undertaking any procedure, regardless who is administering that procedure, even if they are extremely highly qualified. That's my point there. So let's crack on.
Botox information. So Botox is a neurotransmitter and it binds to the endings of the nerve and it reduces the stimulation to the muscle. So it sort of provides a little bit of a barrier between the nerve and the muscle. So if you do a small dosage of Botox, you're going to have a little bit of a relaxation. And if you do a larger dose of Botox, you're going to have more relaxation. Okay. So it relaxes, it doesn't paralyze. It's dose dependent and it's localized. When you inject Botox into a muscle, it stays in that muscle. So, what does Botox actually do for us cosmetically? And what does Botox actually not?
Again, I sort of disagree. Opinions are allowed to vary and differ because we process info differently, we scrutinize differently. When something is being injected in that muscle, wherever the Botox is going to be localized, doesn't mean it's going to remain there. Anything can happen. I'm not bringing you bad news. I'm not a carrier of doom news. But I'm just saying that nothing is assured 100%. It's not possible that all the times when the Botox is being injected is not going to travel to any other part of the cell or neighboring cell around where it's being injected within that muscle. Remember, there is no way the blood won't be around there. There's definitely going to be blood around where it's being injected to carry that Botox into the neighboring cells, and it will diffuse somehow into another organ of the body, as most organs of the body are surrounded by muscles. I don't believe it's going to constantly and always remain in that locality where it's being injected. That I disagree. Maybe it may localize there. It could stay there locally. I'll give it maybe 50%, but even 50% is much. When you inject something, it's gone. You don't know how it's going to travel around the body. So let's proceed.
Help with. Botox can relax what's called our dynamic wrinkles. So when I say dynamic wrinkles, I mean, forehead lines from raising your forehead, 11s from, frowning, squinting, smile lines, crow's feet from squinting or smiling, that type of thing. Okay. So Botox relaxes the dynamic wrinkles and it can prevent and delay static wrinkles from becoming very deeply etched into your face. What Botox cannot do is it does not improve the quality of your skin. It doesn't improve the texture or the quality of your skin. It doesn't improve sun damage. It has no effect on pigmentation. It does not build collagen. Again, Botox does not take the place of skincare. It does not take the place of a healthy diet. It does not take the place of sun protection. It simply relaxes the muscles to soften those dynamic wrinkles. Botox is temporary. They say Botox will wear off anywhere from 3 to 5 to 6 months. Now, there are some contraindications with Botox, and that's why it's important to go to a qualified medical professional because they do need to take a health history. There are certain medications that may be contraindicated with Botox. Certainly, they want to look for allergies. Certainly, don't get Botox if you're pregnant or nursing. So it's really important to go to a provider who will do a medical history and make sure that Botox works with your particular medical history. So potential side effects are pretty minimal. There might be some bruising, very minimal. It's a teeny, teeny, tiny needle. Pain. I don't think the Botox injections hurt at all. It's not even like a bee sting. It's more like a mosquito.
Right. I'm interjecting again. I don't believe that the after effect or any effect or negative effect of Botox is minimal. You cannot tell. As I say, we all differ. There is always room for things to happen. Um, until you do it, until you perform the procedure, you don't know how it's going to respond to your skin, or to your sorry to your the localized area where it's been injected. It's like, say, if I'm given a medication, I know there is always medications are being tested for a very long time with lots of group of people to determine how many of those percentages responded very well to the treatment. But there is always going to be a few or even more that would respond differently to that medication. Um, to say there are no adverse effects, I totally disagree. There is bound to be one, but you pray that it doesn't happen to you when you get your Botox. I'm not against Botox, don't get me wrong. This is my own genuine opinion, okay? And you have yours. So follow your heart. Let's carry on.
bite. The side effect that's probably the most common and the most unpleasant is if you get Botox in the wrong place or at too high of a dose, it can alter or disrupt or drop your facial features. And by that, I mean, if you get too much Botox in your forehead, for instance, it can drop your eyebrows, and we don't want that, right? It can make you look funny. It can give you a hooded lid. And so, because of potential side effects, it is really, really, really important to find a provider that is not only experienced, but has good technical skill, an artistic eye, and maybe even most important of all, an excellent communicator who will ask you, what are your goals? What do you want to accomplish? And really, really work with you to give you a Botox treatment customized.
In addition, like I was saying before, there are possibilities of undiagnosed illnesses in people um, that could cause Botox complications, that should be taken into consideration. Nothing is going to be absolutely 100% perfect with Botox when it's being injected into the muscle. There is, as I've said, there is always room for um, some kind of a new adverse effect that has not been had before. Um, based on a person's health condition, as we age, new health situations begin to surface that the doctor didn't have before. Anything can happen. I'm not bringing you bad news. I'm just saying, just get informed if you're going to have Botox. Okay, so let's carry on.
To exactly what your goals are. And I was lucky enough to find that person right off the bat 16 years ago. Her name is Polly. She's always asked me, okay, what bothers you? My first few treatments, like, I didn't want that sort of stressed out, angry look with the 11s. Like I said, I was 45. I was a single mother. I had a teenage daughter. I had a very demanding, stressful job. And I just started to feel like I looked stressed and angry all the time. I was getting tension headaches. So the very first time I went and got Botox, I shared with her, I just don't want to look stressed and angry. And I was concerned about the 11s because that was really the main area of treatment at that time. So she gave me a light, I can't remember how many units. She treated my 11s. And actually, my eyebrows have always been uneven. One side of my face, the muscles are just much, much stronger than the other side of my face. So my right eyebrow is always way higher than my left eyebrow. And so she was able to sort of even out the eyebrows by putting just a little bit of Botox right here on the left eyebrow, which raised it up. They're still not twins, but she can help me achieve a little tiny bit more symmetry in my face. Botox does take 7 to 14 days to take effect.
Okay, she was talking about one side of her face being more stronger than the other side. And I am of the knowledge that, when you drive your cars, the side where the glass is positioned, um, because of the rays hitting that side of that glass, magnifying the effect of the UVA rays which penetrate glass, that side of the face would break down the muscles faster than the other side. Definitely. Even if you're wearing sunscreen, the aging on that side of your window, your glass window side of your driver's seat, that side of your face will definitely age more than the other side that is less exposed to that glass. And aging, we know, has to do with collagen and elasticity, that holds the structures of the muscles of the face to make it firm. And when we lose that by the effect of those UVA hitting through the glass, being magnified and hitting on this side of the face, the muscle on this side of the face is definitely going to become and appear weaker than this side of the face that is a bit more further than where the window glass is positioned whilst we drive. Okay, so let's proceed.
So you don't see the effects right away. So after a couple of weeks, I looked in the mirror and I just felt like I looked so much more rested, so much less stressed. I was absolutely sold. I absolutely loved how it made me look, and I loved how it made me feel, because I really think that there's some sort of a biofeedback by relaxing those stress muscles in your face. I do believe there is some sort of a biofeedback. I actually started to experience fewer and fewer stress headaches because I was relaxing my stress muscles, right? Anyway, that's all I really did in my 40s. A little bit in my 11s, a little bit to even out my eyebrows, and that took me through my late 40s. Now, when I turned about 50, I started to freak out about the aging process, and I started to be pretty self critical, right? And of course, at the very same time, I was definitely aging. I was definitely seeing more and more signs of aging. So, especially the jowls, the lips, the neck. And so, throughout, every 6 months, meeting with Polly, at one point, she injected my platysmus muscles in my neck. The neck muscles become stronger over time. And so, when the neck muscles overactivate, they can actually pull the jowls down, right? So, by relaxing the neck muscles, she was able to soften my jowls. And so that worked for several years until it didn't work anymore. And we'll get to that in a minute. And then I was noticing those lip lines, upper lip lines, the so called smoker's lines. So she would put just a
Okay, she's saying until it didn't work anymore. So from my understanding of what she's trying to say is that if you use Botox on certain part of your face to try to relax it and get the your determined look, at some point the Botox won't have effect on that muscle anymore to give you that look as we age. Is it that aging is now counteracting the Botox and making it unuseful as we age, meaning we cannot save aging by Botox along the line as we continue to age, or the muscles are becoming weakened and tired that the Botox cannot hold the muscle in place any longer. That's a food for thought. Let's carry on. Mind you, I'm not trying to talk down on this beautiful lady or on this video. I'm just trying to air my views. With this video, it's good that we all learn as well. So you know that going for Botox is a procedure, it's not a joke. You need to be informed, well informed, make your research, do your research very well, and take a proper decision before you take this step of getting Botox. because I know there is this kind of feeling from things I've heard about Botox. When people do Botox, they're so excited looking at the mirror, and as we age, the skin starts to wrinkle more and get lose elasticity and collagen. And every day when we wake up and look into the mirror, we will definitely notice more lines, and we keep going back for more injections and keep plumping the skin to our own satisfaction. And at some point, this Botox would say no. The skin would say no and reject the Botox, and it won't hold anymore. And then what's going to happen? What are you going to do? Okay, so let's carry on.
Little tiny bit of Botox in my upper lip line. Now, I did that on and off for a couple of years. It did soften the lip lines. It didn't make my lips look weird, but it didn't last very long. That would only last like 6 weeks. And I just didn't want to go back every 6 weeks or 8 weeks to get more Botox in my lip. What else did I do? Oh, I remember. So even though I said I have been going to Poly for 16 years, for about 10 years ago, I had one little experience venturing away from Poly. There was some sort of really amazing sale that a clinic near my house was advertising, and the Botox was super, super, super cheap, like half price. So I thought, well, why not? It looks like a great clinic, great reviews. So I made an appointment. I went in. They upsold me so hard. You know, Polly never suggested, oh, you should do Botox here or here. She always asked me what I wanted and then helped me achieve the goal. When I went to this clinic, she said, oh, you need Botox in your crow's feet. You need Botox here. She tried to sell me product. It was a pretty heavy upsell. So even though the Botox itself was much cheaper than what I pay for at my other clinic, I wound up spending more money and being much less happy with the results because I sort of let myself be talked into Botox that I didn't really want or need. And that was my one experience with having Botox in my crow's feet. And what I learned from that, aside from the fact I'm going to stick with Polly because
Okay, in essence, when you go to a place where you're being sold stuff, um, especially in beauty, obviously the marketer they want to sell, and you want the procedure will be talked to or talked at. It's up to you to make your decision before you get into Botox. Decide which part of your face you would like to, take care of before you go, so you don't end up becoming unhappy, as she's saying. So research and knowledge is the key to help you make your informed decision. Okay.
she meets all the criteria. And I trust her and she communicates clearly with me. But what I learned from that is I'm not bothered by happy lines. I like smile lines. Smile lines are happy lines. And so when I got my crow's feet done, I felt like I looked a little bit strange. Now, that could have been an injector technique. I don't know. But I felt like there was a little bit, I felt like it was sort of strange to be smiling and not have any lines, right? And I almost felt like there was a little shelf on my upper cheekbone that sort of came up with that treatment. Now, luckily, Botox is temporary, so it always wears off. But that was the one and the only time I treated my crow's feet because, like I said, my goal with Botox is to look refreshed, rested, and natural, right? And so I'm not trying to erase every single movement or line from my face. I want expression. I just want to look relaxed and happy. Okay. So some people do like to get their crow's feet done. That's fine. It's just not my personal preference. So I have told you about the 11s. You can raise your forehead, not your forehead, you can raise your eyebrows a little bit. by getting a little injection right there. I've told you about my neck. What happened with the neck over time, as I got more and more laxity in my skin, those Botox injections just didn't work anymore. So I stopped doing the neck injections probably about mid 50s. So I did those neck injections for probably about 4 or 5 years. It just doesn't work anymore because now it's not about the muscle pulling my face down. It's just about the facial laxity, right? And the face is.
Right. What she's saying basically is that I've said it again and again that with time, as we age, Botox will not work anymore to help tighten those muscles. The muscles will continue to become weaker. I'm not a bad news bearer, but it's just for us to um accept aging, pro aging, that definitely aging is golden and we will definitely all age. And when we get there, we should accept graceful aging so that we don't get depressed about the lines that we get that naturally are going to happen with time. It's inevitable, and Botox is not going to solve it. From what she's saying, that it can't hold anymore. She went back, but it didn't work, right? Let's carry on.
Is just falling a little bit. The other thing that I am noticing as I grow older, as each of these signs of aging presents itself and I notice it for the first time, I look in the mirror and I go, oh, what is that? What can I do about that? And then over time, I get used to it, right? Over time, it becomes part of my identity to have laugh lines. It becomes part of my identity to have, well, I don't want to say the jowls are part of my identity, but I get used to it and it doesn't bother me as much anymore. Okay. Let's see, what else have I done with Botox? So I've talked about the 11s, the eyebrows, marionettes. The marionette lines are created by a muscle called depressor angularis, right? And this muscle, again, overactivates and gets stronger as we get older, and it pulls the corners of our mouth down, giving us a little bit of an unhappy appearance. And it also can create these marionette lines. So for the last few years, I have had Botox injections in this muscle called the depressor angularis. The typical dose for the depressor angularis is 2 to 5 units per side. And I get 2 units on my left side and 3 units on my right side because, again, the right side of my face is much stronger. And I really think that that does soften the marionette lines very, very subtly. But more importantly, it prevents or minimizes the downward turn of the corners of the mouth, which can give us an unhappy appearance even when we're not unhappy. So, again, my goal with Botox is to look relaxed and happy and not stressed and unhappy. Did I cover everything? Oh, forehead lines. So for many years, I wore bangs, so my forehead lines did not bother me. And then around my early 50s, I started noticing forehead lines pretty significantly. So I did have very, very light Botox. And when you try to treat the forehead lines, like I said, there's a risk of dropping the eyebrows. My eyes have already been sort of hooded throughout my life, so I didn't want to risk that. So in partnering with Polly, we went very, very, very lightly. It's up here at the hairline to soften the forehead lines. And I did like that for a few years. But as I've gotten older, and I am now 61, my skin has more laxity overall. And so what I noticed is that my forehead, even though my eyebrows didn't drop, because my forehead skin is a little bit looser, a little bit more lax, that Botox gave my forehead almost sort of a waxy appearance. So this last time, 6 weeks ago, when I went to see Polly, I said, I'm not going to do forehead Botox anymore. I'd rather have the lines than have my forehead look sort of strangely waxy. So again, I no longer do the forehead Botox. So 6 weeks ago, when I had my most recent Botox treatment, I got fewer Botox units than I had ever had before because, as I've said, I've tried some of these other treatments and I've discontinued them. No longer doing the neck, no longer doing the lips, definitely don't do the crow's feet, don't do the forehead. So this is what we did. According to my research, the typical dosages to treat the 11s or to treat the globular complex is anywhere from 10 to 40 units, right? So the globular complex, and that's usually 5 injections. So what she did for me 6 weeks ago to treat my globular complex, she did 3 injections. She did 3 units there, 3 units there, and 3 units there. So that's 9 units compared to the standard 10 to 40. And then I wanted this eyebrow raised up just a little bit. So she did 4 units here and 3 units here. And that's just to give the eyebrow a little bit of an elevation to help with the hooding. And then we treated the marionettes. Let's see, my right side is my strongest. So she did 4 units right there and 3 units right there. So that's a total of 21 units. So I've literally cut my Botox unit dosages in half, even though I'm quite a bit older. And part of that, like I think I said earlier, part of that is just being more and more comfortable with my aging process. You know, I think it takes a while to get used to the new you, right? As all these signs of aging occur, our first reaction is, oh no, what am I going to do about that? But then over time, you know, it becomes part of your self identity. And I have to say, being here on YouTube and sharing our concerns with each other and knowing that we're part of this over 50, over 60, over 70 community has just really, really helped me accept where I am at in just such a huge way. Okay, to summarize, you know, we're all going to get older. We're all going to get wrinkles, whether we use Botox or whatever. Our aging process will continue. And I do want to age gratefully and gracefully and healthfully and take care of my health and take care of my skin and do my skincare and my sunscreen and all of that. And I really do feel like Botox has been very helpful as a tool to achieve those goals. So I would love to hear what your thoughts are on Botox. Have you had treatments? Have you had positive experiences? Have you had negative experiences? Again, I am not here to sell anybody Botox or encourage or push anyone to do Botox. I think that we are all following our own path and we can support each other and encourage each other and respect each other's decisions. Okay, I think I covered it. Thank you for hanging in there with me once again. I always really, really, really appreciate your.
Okay, all right. Full screen with me now. Okay, this is my finding, and I'm sharing it with you. You can see from the screen, it's showing the link or the website where I'm going to be taking this reading from regarding Botox. As you know, I take my sources from a reliable place of expertise, and this reading is from the Mayo or mayoclinic.org. It's about Botox injections. I'm going to read out so we can both learn. Hey. Right, it says Botox injections. Overview. Botox injections are noted primarily for the ability to reduce the appearance of facial wrinkles. They are also used to treat conditions such as neck spasm, cervical dystonia, excessive sweating, hyperhidrosis, and overactive bladder and lazy eye. Botox injections may also help prevent chronic migraines. Botox injections use a toxin called, it's a long name, Okay, I'm going to try to pronounce it. Onobotulinum toxin A, to temporarily prevent a muscle from moving. This toxin is produced by the microbe that causes botulism, a type of food poisoning. I am wary about this toxin. If it's being called toxin, why is it being injected into the muscles of the inside the body where the cells are? These toxins could be carried around the other organs of the body, the cells in our body, by the blood. Um, and when it infuses or diffuses into other parts of the organs in the body, if it travels round, as you know, there is definitely circulation. When something goes into your bloodstream, it will circulate. It gets to every part of your body before it's being excreted. It touches, it goes around your brain, your heart, your kidneys, your liver, and other parts of the body. And I'm wondering how safe it can be. If it's a toxin, maybe it needs to be rewarded. If it's a toxin, I'm not getting that. Even if my skin is wrinkling away and is falling off, hanging by the thread, I'm not going to do that. But it's up to you. It should be better worded and not a toxin, definitely. So I'm going to carry on reading. Botox was the first drug to use botulinum toxin. Other products now include abobotulinum toxin A, Diosport, Rimabotulinum toxin B, Myoblock, and Incobotulinum toxin A, Zeomane. Each is a little different, particularly when it comes to dosing units, so they aren't interchangeable. Why it's done? Why is Botox done? Botox injections block certain chemical signals from nerves, mostly signals that cause muscles to contract. The most common use of these injections is to temporarily relax the facial muscles that cause wrinkles in the forehead and around the eyes. Botox injections are also used to treat conditions that affect how the body functions. Examples include cervical dystonia. In this painful condition, your neck muscles contract involuntarily, causing your head to twist and turn into an uncomfortable position. Lazy eye. The most common cause of lazy eye. The most common cause of lazy eye is an imbalance in the muscles responsible for positioning the eye. Muscle contractures. Some neurological conditions, such as cerebral palsy, can cause your limbs to pull in towards your center. In some cases, these contracted muscles can be relaxed with Botox injections. Hyperhidrosis. In this condition, excessive sweating occurs even when the temperature isn't hot and you are not exerting yourself. Chronic migraine. If you experience migraine more than 15 days a month, Botox injections may help reduce headache frequency. Bladder dysfunction. Botox injections can also help reduce urinary incontinence caused by an overactive bladder. Take note. Eye twitching. Botox injections may help relieve contracture or twitching of muscles around the eyes. And these are the risks of Botox. Botox injections are relatively safe when performed by an experienced doctor. When performed by an experienced doctor, I'm repeating it so you take notes. It is important point to take. Possible side effects and complications include pain, swelling, or bruising at the injection site, headache or flu-like symptoms, droopy eyelid or cockeyed eyebrows, crooked smile or drooling, eye dryness or excessive tearing, Although very unlikely, it is possible for the toxin in the injection to spread in your body. Call your doctor right away if you notice any of these effects hours to weeks after receiving Botox. Muscle weakness, vision problems, trouble speaking or swallowing, breathing problems, loss of bladder control. It says doctors generally recommend against using Botox when you're pregnant or breastfeeding. And Botox should not be used in people who are allergic to cow's milk protein. I repeat, Botox should not be used in people who are allergic to cow's milk protein. Select your doctor carefully. Botox must be used only under a doctor's care. It is important that injections be placed precisely in order to avoid side effects. Botox therapy can be dangerous if it's administered incorrectly. Ask for a referral from your primary care doctor or look for a doctor who specializes in your condition and who has experience in administering Botox treatments. A skilled and properly certified doctor can advise you on the procedure and help determine if it best suits your needs and health. How you prepare. Tell your doctor if you've had any type of Botox injection within the past 4 months. Also tell your doctor if you take muscle relaxants, sleeping aids, or allergic medications. If you take blood thinners, you may need to stop taking them several days before your injection to reduce your risk of bleeding or bruising. What you can expect. Okay. Before the procedure, most people don't feel much discomfort during the procedure, but you may want your skin numbed beforehand, especially if your palms or soles are being treated for excessive sweating. Your doctor might use one or more of various methods available to numb the area, such as topical anesthesia, ice and vibration anesthesia, which uses massage to reduce discomfort. During the procedure, Botox injections are usually performed in a doctor's office, not in your backyard, okay? I just added that one, not in your backyard, not in your village, not in your kitchen, not in your shed, in doctor's office. Be informed, okay? Your doctor uses a thin needle to inject tiny amounts of botulinum toxin into your skin or muscles. Into your skin or muscles. When they say muscles, is internal, is inside, is not on the surface, it's no more cosmetics. This is going physiological into your muscles where blood resides. And this is a botulinum toxin. Anything is possible with this toxin for sure. The number of injections needed depends on many factors, including the extent of the area being treated. After the procedure, do not rub or massage the treated areas for 24 hours. I repeat, do not rub or massage the treated areas for 24 hours. This may help prevent the toxin from spreading to a different area. And if it spreads to a different area, what happens? You don't want to know that. And I, for one, don't want to know definitely. Because if it travels to where it's not meant to be, I do think it's passing its boundary, and that the organelles or organs around where it's trespassing to won't like it. They won't be happy, okay? Because they are meant to protect that area. They're going to definitely attack this toxin, and something is going to happen. You know, where the elephant fight, the grass will suffer. The cells around there where it's not needed will definitely be trying to fight it off because it's not meant to be there. In fact, when something goes into the body from from outside to into the body, the way the phagocytes we react to fight off an intruder of this botulinum or botulinum toxin, um, would determine your result as well when you're having that Botox. I disagree that every Botox is successful, performed by the highest skilled expert. I do not believe that is always going to be successful. There's always room for negatives. You should take that into consideration before you decide to go for Botox, and it's not permanent. They say it's temporary. If that is what you really want, go for it. Why not? Okay, but protect your skin, the outer layer of your body, because there's no point in having Botox and all those wrinkles are reduced. You're not wearing sunscreens. You're not doing the necessary things you're supposed to do as a skincare to nourish and protect your skin barrier, which is very, very important. Okay. You can return to your normal activities right away after the procedure. But my point now is that after this procedure, they said do not rub or massage for 24 hours. Say you've gone to a night shift or you've done some job before you go for this procedure, you need to rest. You lay down on your pillow. When you sleep, you can't control the positions your body will take. You just move around as you sleep, and definitely there is no way you're not going to be rubbing your face on the pillows within that 24 hours, unless you stay awake for 24 hours, devoid of sleep. Um, and then this spreading of this botulinum toxin will not spread to other parts of your different area of your muscle or different area of the cells within where it's been injected. So please take precaution. Think very well before you undertake any procedure. Make sure you're well informed, do your researches. I'm not saying don't get Botox. I'm not against Botox. I'm just saying be sure you know much about Botox. You know the ins and outs of Botox, the effects, your based on your health, underlying health conditions, before you take that journey, because it's not permanent, okay? And it doesn't slow aging. It's a temporary fix. And once it wears off, you need to go and re-inject yourself. Results. I'm still reading results. Botox injections usually begin working 1 to 3 days after treatment. Depending on the problem being treated, the effect may last 3 months or longer. To maintain the effect, you will need regular follow-up injections. Is that what you want? I don't want that. I know we have a price to pay for beauty. The happy fine lines are not terrible for me. Pro aging is where I stand. If Botox is the way you want to go, make sure you do it well and be happy with it. Okay. So I think we've covered everything. I've said all that I need to say regarding this video. Um, I hope you enjoyed it. I'll be back again. Please like, share, subscribe. And I hope to see you again soon. It's only me, Lucia. Bye bye.